If you're over 60 and you've been drinking plain water thinking it's the healthiest choice, I need to tell you something today that could change everything about how you feel. Your body isn't the same as it was at 30. And plain water, it might actually be working against your cardiovascular system. I've been a physician for over 20 years, and I've watched thousands of patients, especially women in their 70s, come into my office exhausted, short of breath, with poor circulation they thought was just normal aging. But here's what surprised me. Most of them had a simple electrolyte deficiency they didn't even know about. Today, I'm going to show you the one trick that changed everything for my patients, and it's going to surprise you how simple it is. But before we get there, if you're watching because you care about your heart, your energy, or how you feel climbing stairs, hit that like button and subscribe, because this is the kind of thing nobody talks about in mainstream medicine. I'm Dr. Alex Mandell, and for the last 2 decades, I've specialized in preventive care for adults over 60. What I've noticed, and this is backed by decades of cardiovascular research, is that hydration after 60 isn't about quantity. It's about quality. Your body changes, your kidneys work differently, your thirst mechanism weakens, and your cells need something more than just H2O to function at their best. The research is clear on this, but it's not sexy enough for the media. Nobody can sell you plain water with a fancy campaign. In this video, I'm going to break down why plain water alone isn't optimal for seniors, what your body is actually craving, how this one change improves blood flow, energy, and cardiovascular health, real patient stories from my practice, exactly how to implement this today. Remember to like, share, and subscribe for more senior health insights that your doctor might not be telling you. Let me start with a patient story. I remember speaking with a 72-year-old patient, consider him as Robert, who came into my office complaining of fatigue. His children had noticed something was changing. He couldn't keep up with his grandchildren anymore. Walking upstairs left him breathless, and the worst part, he was doing everything right. Robert was drinking 8 glasses of plain water a day. He'd read all the health articles. He was committed to hydration. But when I checked his electrolyte levels, they were dangerously low. His sodium was depleted, his potassium was insufficient, and his body couldn't maintain proper blood pressure or fluid balance. Here's what most people don't understand. Plain water actually dilutes your electrolytes when consumed in large quantities without mineral supplementation. This is especially true if you're on medications, and most seniors are. Your cardiovascular system depends on electrolytes. Sodium regulates blood pressure, potassium maintains heart rhythm, magnesium supports blood vessel function. Without them in proper balance, even perfect hydration fails. But wait, there's something your doctor probably hasn't told you about aging and water absorption. Your gut changes. Your ability to absorb minerals decreases. So even if you're eating the right foods, you might not be getting enough. What happened next surprised even Robert's family. Within 2 weeks of changing how he hydrated, his energy returned. His breath came easier. His grandchildren noticed he was keeping up again. That's the power of proper electrolyte balance. Now, I want to be very clear. This isn't about fancy sports drinks loaded with sugar. Those are not the answer. This is about understanding the science of cellular hydration. When you drink plain water alone, it's absorbed quickly. It dilutes your bloodstream. Your body then tries to compensate by eliminating excess water through your kidneys. You urinate frequently, and electrolytes get flushed out in the process. But when you add electrolytes, particularly sodium and potassium, in the right ratio, something different happens. The water is absorbed more slowly. It stays in your bloodstream longer. Your cells actually hydrate properly, and your cardiovascular system maintains the balance it needs. I had another patient, consider her as Margaret, a 68-year-old woman who was experiencing dizzy spells. Every time she stood up, she'd see black spots. Her children were worried she'd fall. She was terrified of losing her independence. That fear is real for many of you watching. Margaret had orthostatic hypotension, a fancy term for blood pressure dropping when you stand. She thought it was inevitable aging, but it wasn't. It was electrolyte depletion. The research is linked to this. Seniors with low sodium and potassium show significantly reduced blood flow to the brain when standing. That's what causes the dizziness. But most doctors reach for blood pressure medication first without addressing the root cause. When Margaret started adding the right electrolyte balance to her hydration, those dizzy spells stopped. She could stand confidently. She could play with her grandchildren without fear. That's independence. That's quality of life. Most seniors completely miss this point. You're not just thirsty. Your cells are starving for proper mineral balance. If you're finding this helpful, please hit like and share this with a family member who needs to hear this. These videos help so many people. Let me explain the physiology in simple terms. Your blood is essentially salt water, about 0.9% sodium content. When you drink plain water, that concentration drops. Your body perceives this as a dilution emergency. Your blood vessels respond by constricting slightly. Your heart has to work harder to push the more diluted blood through your system. This might sound subtle, but over time, especially combined with the natural aging of your cardiovascular system, it adds up. Now, when you maintain proper electrolyte balance, something different happens. Your blood osmolarity stays optimal. Your vessels stay relaxed and flexible. Your heart pumps more efficiently. Blood flow to your extremities improves. Oxygen delivery to your brain improves. I remember one more patient. Consider her as Catherine, a 76-year-old woman who had cold hands and feet constantly. She wore gloves indoors. Her children thought it was Raynaud's syndrome, but it was actually poor peripheral circulation from years of inadequate electrolyte hydration. Catherine's grandchildren noticed first. They said, "Grandma, you don't have cold hands anymore." Simple observation, powerful change. She thought losing circulation was part of aging. It wasn't. The research on this is quite clear. Studies in the journal Hypertension have shown that proper sodium-potassium balance is associated with improved peripheral blood flow in older adults. But nobody makes money from mineral water, so you don't hear about it. Here's what surprised me the most in my practice. Most patients over 60 who were experiencing fatigue, dizziness, or cold extremities were actually electrolyte depleted, not sick in the traditional sense. I want you to check yourself right now. Do any of these sound familiar? Dizziness when you stand up quickly, constant fatigue even after sleeping, brain fog or difficulty concentrating, muscle cramps or weakness, cold hands and feet, frequent urination with clear urine, lack of thirst, dehydration paradox, shortness of breath with minor activity. If you're experiencing even 3 of these, your body might be telling you it needs more than plain water. I had a patient, consider him as James, a 70-year-old who was convinced he had heart disease. He experienced chest tightness with stairs. His wife was worried. He saw 3 cardiologists. They found his heart was actually fine. It was dehydration affecting his capacity. What happened next changed his life. Proper electrolyte hydration eliminated the chest tightness completely. He went from thinking he had a failing heart to climbing stairs with confidence, all because of how he hydrated. If you're relating to this, please like and subscribe. Share this with your family. Your children need to know this stuff too. Now, let me give you the practical framework. This is what I recommend to my patients, and it's based on decades of research from the American Heart Association and the National Institute of Health. First, add a pinch of mineral-rich salt to your water, not table salt, sea salt, or Himalayan salt. A small pinch per 8-ounce glass. This replicates your body's natural osmolarity and ensures the water is actually absorbed by your cells. Second, incorporate foods rich in potassium. Bananas, sweet potatoes, leafy greens, avocados. Your body absorbs minerals better from food than supplements. Third, consider a low-sodium electrolyte drink if you're very active or live in a hot climate, but read the label, avoid anything with added sugars. You want electrolytes, not a candy beverage. Fourth, distribute your hydration throughout the day. Drink slowly and consistently rather than large amounts at once. This allows your kidneys to regulate electrolytes properly. I had one more patient, consider her as Dorothy, an 80-year-old who thought her days of gardening were over. She was exhausted all the time. Her daughter was worried about her quality of life. She thought she was just getting too old. When Dorothy started hydrating with electrolytes, something remarkable happened. Within a week, she had energy. Within 2 weeks, she was back in her garden. Within a month, she was spending full days outside something she thought she'd lost forever. Her daughter said something that stuck with me. "I got my mother back." That's what proper hydration does. It restores independence. It restores confidence. It restores the ability to do what matters. Let me clear up some common misconceptions. Myth: more water is always better for you. Fact: pure water without electrolytes can actually dilute your blood and impair your cardiovascular function. Quality matters more than quantity. Myth: salt is bad for you, so you should avoid it completely. Fact: your body requires sodium for blood pressure regulation and nerve function. The issue is excess processed salt, not mineral salt in proper amounts. Myth: if you're thirsty, you should drink water. Fact: your thirst mechanism weakens dramatically after 60. You're often dehydrated before you feel thirsty. That's why consistent hydration matters. Myth: electrolyte drinks are just for athletes. Fact: any adult over 60 benefits from proper electrolyte balance, especially those with cardiovascular concerns or medication use. Like, share, and subscribe if this is changing how you think about hydration. Before we finish, I want to remind you, the patients I've shared today, Robert, Margaret, Catherine, James, Dorothy, they all thought their symptoms were just part of aging. They thought they were losing their independence. They thought it was inevitable, but it wasn't. It was science. It was physiology. And it was completely reversible. Starting tomorrow, stop drinking plain water alone. Add that pinch of mineral salt. Add those potassium-rich foods. Watch how your body responds over the next 2 weeks. You might be amazed. Your blood flow will improve, your energy will return, your independence will strengthen. That's not an exaggeration, that's physiology. If this helped you, please like and subscribe, share this with your family, comment below what symptoms have you been experiencing. Let me know if this works for you. Your story might help someone else reclaim their life. I'm Dr. Alex Mandell. Thank you for watching, and I'll see you in the next video.